We're just going to talk about use of these CRE balloons for the teaching for these two students here, and let's see how these parts work. First of all, where do we use the CRE balloon? When there is a stricture, we want to dilate it. So this is completely sterile one, which is packed up in this one, and then this is the special gun to actually use that one to push the dilatation. So there are some markings here. So 6 equals 2, 7 equals 5.5, and 8 equals 9.5. What does this mean? And if you see the actual dial here, if I ask them to increase the balloon by 6 millimeters, they need to put that to the 2, which equals to that. And if I say balloon up to 7 millimeters, then they go to 5.5 on this here, for example. Just show you there. So that's what we're going to do. So I'm going to show them some demonstration here, because this is going to be a first time one. I don't want to open it here, and I will continue that when we actually finish with the test. There should be a training balloon which I'll show them. The question here is, once you actually open the balloon, to put through the scope can be difficult. That's why I'm not opening it. So the other thing you need to know here is that there's a green here and red here. So when I ask them to open up the balloon, which is actually closed when I put it through the scope, so they turn this one towards forward, and the fluid here goes through this one, and then put the fluid in this one to dilate up. And when I ask release the balloon, they turn this particular one back to the red side. So this one goes, can you hold it for me? So they go like that. When you want to open up the balloon, dilate it. When I ask to deflate the balloon, they do that way. So which I'm going to teach them today and see what happens.